Turning 65 is a milestone, a new chapter in your life. But as you embrace this moment, there's one decision that could shape your future more than any other. Your first Medicare plan. Choosing the right Medicare plan can feel confusing, even daunting. You've heard the stories, hidden costs, unexpected coverage gaps. But it doesn't have to be this way for you. You deserve to feel confident, informed, and prepared. This is your health, your well-being, your peace of mind at stake. Because when it comes to your health, turning 65 is a milestone, a new chapter in your life. But as you embrace this moment, there's one decision that could shape your future more than any other. Your first Medicare plan. Choosing the right Medicare plan can feel confusing, even daunting. You've heard the stories, hidden costs, unexpected coverage gaps. But it doesn't have to be this way for you. You deserve to feel confident, informed, and prepared. This is your health, your well-being, your peace of mind at stake. Because when it comes to your health, making the right choice now could change everything. You've spent a lifetime caring for others. Now it's time to care for yourself. Let's make sure your next step is the right one. Welcome to your community, Vivek's Wealth and Insurance Solutions, together with Secure 65 Health Plans, where seniors thrive. Join us. What you must know before enrollment starts. We are your senior advocates, Alicia Alcano and Monet Swan. No senior should ever enroll in Medicare with a stranger. Secure 65 Health Plans, where seniors thrive. Vivek's Wealth and Insurance Solutions. Welcome. my goodness. Hello again. Hello again. Sounds like a name of a movie. Wow.
Welcome in, Monet. No technical issues today. Not in
That
this session.
that is right. I'm just checking to make sure, listening to myself. But I got to tell you, when I looked at that opening video, Alicia, I wonder how long it took them to get all those guys to be on the right foot when they were doing it to the music. You see? I love it. I love it. I love it. You guys, we have too much fun doing this. So, welcome again to your first Medicare plan and what you must know before enrollment starts. So, whether it's your first or not, everyone should be familiar with these insurance terms and how Medicare works. I'm Monet Swan, CEO of Vivix Wealth and Insurance Solutions.
And I'm Alicia Alcano, Chief Operating Officer for Vivix Wealth and Insurance Solutions. We are delighted to have you here. No technical issues allowed.
I love it. Again, you got to say what you want ahead of time, you guys. So, again, whether you're approaching 65 or assisting a loved one, making the right Medicare choices can feel overwhelming. Our goal today is to simplify this process and empower you with actionable steps. So, Alicia, let's get it started.
Thank you, Monet. So, today's agenda, we'll have a wonderful time again together.
Yes.
So, today we're going to go to discuss Medicare basics, the five major parts of Medicare, how to choose the right agent, what to look for in a carrier, evaluating coverages and premiums, actionable steps to enroll.
Okay, so let's go. Let's start with the fundamentals. Medicare is a federal health insurance program primarily for people age 65 and older. However, it's important to know that Medicare also provides coverage for individuals under 65 with certain disabilities, as well as those of any age with end stage renal disease known as ESRD or amyotrophic lateral sclerosis, also known as ALS. This means that even if you're not yet 65, you or a loved one could still be eligible for comprehensive coverage under Medicare, ensuring that no one is left without the care they need during challenging times.
Medicare is divided in four parts: A, B, C, and D, each covering different aspects of healthcare. Medicare Part A, hospital insurance. It helps cover inpatient hospital stays, care and skilled nursing facilities, hospice care, and limited home health care. Most people do not pay a premium for Part A if their spouse or themselves pay Medicare taxes while working. Medicare Part B is medical insurance. It covers doctor's visits, outpatient care, preventive services, and medical supplies. Now, Part B requires a monthly premium and helps ensure that routine medical needs, such as doctor's visits and lab tests, are taken care of. Medicare Part C is also known as Medicare Advantage. It is an alternative to original Medicare Parts A and B and is offered by private insurance companies approved by Medicare. Medicare Advantage plans often include additional benefits like vision, dental, and hearing coverage, as well as prescription drug coverage, all bundled into one plan. Medicare Part D is prescription drug coverage. It helps cover the cost of medication and is available to anyone with Medicare. You can get Part D either as a standalone plan or as part of a Medicare Advantage plan that includes drug coverage. Together, these parts of Medicare offer a comprehensive healthcare solution to cover a wide range of medical needs, giving you a peace of mind as you navigate your healthcare journey.
I love it. So, let's get into the weeds, you guys, because I want to make sure that you understand what traditional Medicare offers. So, traditional Medicare works with Part A, and it covers inpatient hospital stays. It also covers skilled nursing facility care, hospice care, and some home health. So let me give you an example of how you would use your Part A Medicare coverage. Let's say let's say you're at home and you slip and fall in the bathroom
and you fracture your hip. And this happens all the times, you guys. So it's not something that's way out there that couldn't happen to you. And an ambulance takes you to the nearest hospital and you undergo surgery. Now, after the surgery, you are admitted to the hospital to recur during your 5-day hospital stay. While you're there, you receive medical care, which includes the surgery, nursing services, medications, and meals. Your Medicare Part A will cover most of your inpatient hospital care. Medicare Part A helped pay for your hospital room, nursing care, and other necessary hospital services. Your Part A picks up much of the burden of the hospital stay, allowing you to focus on healing without the stress of overwhelming medical bills. So, if you are lucky enough to be discharged, you may require additional care at a skilled nursing facility. Now, how it works is Medicare Part A will also cover a portion of these costs, providing up to 100 days of skilled nursing care per benefit period to further support your recovery. So it's important to know that Part A takes effect when you are admitted to the hospital as an inpatient or need skilled nursing facility care. Its main purpose is to cover essential costs associated with your hospital stays, your surgeries, and specialized post hospital care. How about that?
Thank you, Monique. Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. Let's say you're in relatively good health, but lately you have been feeling more fatigued than usual and maybe even experiencing a little shortness of breath. You're concerned, so you call your primary care physician for an examination. During the visit, the doctor conducted a thorough examination, including blood tests, an electrocardiogram, also known as EKG. The tests show that you have an irregular heartbeat, and your primary doctor refers you to a cardiologist, a specialist, for more evaluation. Throughout this process, Medicare Part B is playing a crucial role in helping to cover the cost of your doctor's visit, the specialist, consultation, diagnostic tests, and outpatient procedures. All good, right?
Yes.
Part B also contributed to the expenses of his prescribed medication under certain circumstances, as well as medical equipment like a home blood pressure monitor. So, to summarize, Part B covers medical services outside of a hospital stay. Part B covers doctor's appointment, specialist visits, outpatient care, preventive services, and certain medical equipment.
So, you guys, it's so important to remember Part A and Part B. Well, they're great, but they don't cover everything. It does not cover your prescription drugs. You need Part D for that. Root doesn't also cover routine dental care, vision exams related to eyeglasses, hearing aids, or long term care, custodial care, such as nursing homes. Additionally, services like acupuncture, cosmetic surgery, and medical care received outside of the US are generally not covered. Also, Medicare Parts A and B have no maximum out of pocket limit, which means there's no cap on the amount you might have to spend in a year. Beneficiaries are responsible for deductibles, co-payments, and co-insurance. So, for example, in 2024, the Part A deductible for inpatient hospital stays is 1750. That's right, $1,750 per benefit period. If you're hospitalized multiple times in a year with benefit periods that don't overlap, well, you may have to pay this deductible more than once. And then after 60 days of hospitalization, you start paying daily. It's kind of crazy, but the coinsurance does amount to larger, significant costs that you're going to be responsible for. And then, as if that's not enough, there's also your annual Part B deductible of $250 in 2025. After meeting this deductible, you're typically responsible for 20% coinsurance of the Medicare approved amount for services like your doctor visits, your outpatient care, and durable medical equipment. So without additional coverage like Medicare supplement or also known as Medigap policies or a Medicare Advantage plan, well guess what? These expenses and the absence of a cap out of pocket, they can quickly add up and cost you a lot of money. So I want you to understand this because it can lead to substantial financial strain. When we talk about that, we are really concerned about those who are on fixed incomes. It makes it a challenge to manage healthcare cost effectively. And that's why we're having this talk today. Right, Alicia?
That's a lot of expenses, money. So let's talk about Medicare supplement plans, also known as Medigap, are sold by private companies to fill the gaps in original Medicare coverage, like copayments, coinsurance, and deductibles. A Medicare supplement insurance, Medigap policy, is a private health insurance plan designed to cover some of the costs that original Medicare Parts A and B doesn't pay, such as copayments, coinsurance, and deductibles. Sold by private insurance companies, Medigap policies fill the gaps in original Medicare coverage, helping you to reduce out of pocket expenses for Medicare recipients. These policies are standardized and regulated, meaning that each plan offers the same basic benefits regardless of the insurance carrier, although premiums may vary. By purchasing a Medigap policy, individuals can gain more predictable healthcare costs and broader financial protection when assessing medical services.
I love it. I'm just so glad you really touched on that. Okay. So to understand how these all these policies work together, let's say you are enrolled. Let's say you're enrolled in original or traditional Medicare. Now, let me tell you, sometimes these terms are used interchangeably, you guys, but they mean the same thing, which is Medicare A and B. Okay, that's what we're talking about, traditional or original. Okay, all right. So let's say you start having chest pains and you're rushed to the hospital. You undergo a series of tests and a brief stay because you didn't have a heart attack or something serious that required ongoing outpatient treatment. And typically, a few weeks later, something comes to your mailbox. You start receiving the charges for the medical bills that Medicare didn't fully cover. Now you're upset because charges are coming in for deductibles, they're coming in for coinsurance, and you are now on the hook and required to pay thousands of dollars that you never expected. You never ever thought in a million years that that out of pocket expense was going to be that high. So now you call me very upset. And I explained that original Medicare covers many services. Oh, it's great, but they don't cover everything. And that I only wish that I had met you earlier because I would have suggested a Medigap policy and explained that this plan was designed to fill in the gaps that Part A and Part B leave open to you to pay, like the deductibles, co-payments, and coinsurance that Medicare Parts A and B just don't cover. Unfortunately, you had to go back to the hospital again a little bit later that year. However, this time you were my client and you were enrolled in a Medigap policy. You called me and you told me how thrilled you were because you came home feeling better and your Medigap policy had covered most of your out of pocket expenses, leaving you with just a very little small tiny medical bill. So, you guys, here are the four main reasons to buy a Medigap policy. One is that it gives you out of pocket expense protection. Two, when with a Medigap policy, you know what your costs are going to be and you can be better prepared when the unexpected happens. Three, flexibility. Medigap policies are accepted by any provider that accepts Medicare, giving you nationwide coverage without network restrictions. And there are very few providers that do not take Medicare. Four, you receive comprehensive coverage, meaning that Medigap can cover a range of costs, including foreign travel emergencies, which original Medicare doesn't cover. So, for those of you who like to travel, you want to get this plan. And personally, I don't know why anyone would leave themselves vulnerable to out of pocket expenses, especially when you can get a Medigap policy, unless it's solely based around cost. And that I understand as well. Alicia?
I'm with you, Monique. So let's give you another alternative. Medicare Advantage plans, also known as Part C, are all in one alternative to original Medicare. Now, they include Parts A, B, and often Part D. These plans combine the benefits of original Medicare, Part A, Parts A and B, and often include additional coverage, such as prescription drugs, dental, vision, and hearing services. The advantages of Medicare plans include lower out of pocket costs, comprehensive coverage, with added benefits, and the inclusion of an annual out of pocket maximum, which provides financial protection against high medical expenses. However, they
Uh-oh.
also come with limitation. Yeah,
Uh-oh.
such as restricted provided networks, the need for referrals to see specialists, and variant plan rules that can complicate care coordination. Now, Medicare Advantage plans are ideal for Medicare recipients who prefer having all their healthcare needs managed through one single plan, appreciate the added benefits, and are comfortable selecting providers within a specific network. These plans may offer extra benefits like we said, vision, hearing, dental, and wellness programs. However, they may have network restrictions. Let's be aware of that.
They will.
Yes. Now, let's talk about MAPD, a Medicare Advantage prescription drug plan. It's a type of Medicare Advantage plan that includes prescription drug coverage under Part D, offered by private insurance companies approved by Medicare. MAPD plans bundle all your Medicare benefits into a single comprehensive plan. This means that MAPD plan provides all the coverage of original Medicare Parts A, the hospitals, B, medical insurance, allow with prescription drug coverage, and often additional benefits like dental, vision, hearing, and wellness programs. And how it works is, well, you enroll in a MAPD plan, you're effectively combining your Medicare health coverage and prescription drug coverage into one plan, managed by a single insurance carrier. Now, your MAPD plan administers all Parts A, B, and D benefits, streamlining your healthcare services under one plan with one membership card. Now, remember that they are provided networks. MAPD plans may have specific networks of doctors, hospitals, and pharmacies you must use to receive the lowest cost. This can include health maintenance organizations, HMOs, or preferred provider organizations, PPOs. They often have set copayments or coinsurance for doctor's visits, hospital stays, and prescriptions, which make your out of pocket costs more predictable. In the prescription drug coverage in a MAPD, plan comes with its own formulary. What is that? List of coverage drugs in pharmacy network, which may affect which medications are covered and where you can fill your prescriptions.
Now, if you don't want a Medicare Advantage plan because they're not for everybody with a prescription drug, well, guess what? You have options. You can get a Medigap and purchase a standalone Part D, also known as prescription drug plan. Okay, here we go with the acronyms and all that PDP, right? But it's imperative that you consider your medication needs when selecting a Part D plan. As Alicia said, can the cost for the formularies can vary widely. Okay. This plan can be purchased separately and used alongside your Medigap, aka your Medicare supplement policy. Just like to say it again so you guys don't get confused. Since Medigap plans sold after 2006 do not include prescription drug coverage, enrolling in a standalone Part D allows you to obtain coverage for all of your medications. So let me tell you a little bit about how this works, how the Medigap policy works. So it will help pay for your out of pocket expenses like your deductibles, co-payments, and your co-insurance under original Medicare Parts A and B, while the separate plan, Part D, covers your prescription drugs. This arrangement is used to ensure comprehensive health care coverage while minimizing minimizing the gaps by covering both medical services and prescription medications, and is especially beneficial for those who prefer the flexibility of original Medicare and want to tailor their coverage to fit their specific needs. With the implementation of the Inflation Reduction Act starting in 2025, significant enhancements have been made to Medicare Part D. Notably, there will be a $2,000 cap on annual out of pocket spending for prescription drugs. And this is going to provide greater financial protection against high medication costs. Some of you guys are paying thousands of dollars. This is a blessing come true, right? Additionally, the maximum deductible for Part D plans in 2025 is set at $590. Through though the plans may offer this as a deductible for some, it's not for every one of them. Some of the plans may offer lower deductibles or waive them entirely.
That is correct, Monique. Now, there's another plan to consider. Oh my goodness, another one. Yes, if you qualify, Medicare and Medicaid is available if you are eligible for what is called Medi plan in your state, which can offer additional benefits and lower out-of-pocket costs. These plans coordinate benefits between Medicare and Medicaid to provide comprehensive coverage. Medi plans were created to support you, some of the most vulnerable populations, by providing comprehensive, cost-effective healthcare coverage through a combination of federal and state resources. By coordinating Medicare and Medicaid benefits, these plans aim to improve access to care, reduce financial barriers, and enhance the overall health and well-being of dual eligible individuals. A Medi plan, also known as Dual Eligible Special Needs Plan, the SNPs, is designed for individuals who qualify for both Medicare and Medicaid benefits, often referred to as dual eligibles. Now, dual eligibles are eligible for Medicare for federal health insurance program, and Medicaid, the state and federal programs offering assistance with medical costs. Medi plans combine the benefits of Medicare Part A and B, and often Part D for prescription drugs, with Medicaid services. This integration simplifies access to healthcare services. These plans may offer extra benefits such as dental, vision, hearing, and one more, transportation services that are typically not covered by original Medicare. They include cost sharing and care coordination. Many Medi plans often include care coordination services to help manage the healthcare providers and services effectively, improving overall health outcomes. Medicare is funded through federal taxes, premiums, and general revenues. Medicaid is jointly funded by federal and state governments, but administered by individual states according to federal guidelines. When it comes to eligibility and benefit, states have flexibility in determining eligibility criteria and that scope of benefits beyond mandatory federal requirements. They may offer services not covered by Medicare, such as, let's listen carefully, long-term care, personal care services, and home and community-based services.
I love that because I think everybody needs to have, they all need to have coverage. No matter how much money you make, you should get the health care protection that you deserve. Now, let's talk about picking the right agent. As the CEO of Vivix Wealth and Insurance Solutions, I cannot, I cannot emphasize enough that choosing the right Medicare agent isn't just a small decision. It's crucial, and it's a crucial step towards securing your health and peace of mind for the rest of your life. Here are some steps that you should take for this year's annual enrollment period. First, I want you to avoid call center agents. These are massive operations with countless agents across the country, and chances are you'll never speak to the same person twice. They're trained to follow a script, focusing on making the fast sale rather than understanding your specific needs, like having coverage if you travel out of the country a lot. They don't have time to learn about your individual needs, your concerns, or your goals. This is why your phone call drops or you are disconnected when you can't make a decision right away, or you get somebody who's very pushy and aggressive. Does this sound familiar? Well, with us, you're more than just a number, and you deserve the personalized attention. You have earned it, and we don't promote a one size fits all pitch. Number two, steer clear of captive agents. These agents work exclusively for one insurance company. This means they can only offer you their company's plans, meaning they can't and won't tell you if a competitor has a plan that's a better fit for you. So, how does this harm you, you ask? Well, you just can't make an informed decision. You can't do that when you don't know what's really out there. The Centers for Medicare and Medicaid Services, also known as CMS, requires that all brokers and independent agents provide a clear disclaimer within the first minute of any Medicare enrollment call. The required compliance statement is, we do not offer every plan available in your area. Currently, we represent, and then that broker or independent agent would put in the number of plans that they represent in that area. It will follow through with please contact Medicare.gov or 1-800 Medicare to get information on all of your options. So, why do you think they do that? Well, because this disclaimer ensures transparency and informs the caller that the agent may not have access to all of the available Medicare plans in your area. But what about captive agents? Well, CMS doesn't require the same specific disclaimer for them. So you don't know if there are any other plans that are better suited for your needs, and they aren't going to be able to tell you. It's like going to Target and asking the clerk, is this available at Walmart? Well, of course they don't know, but you don't expect them to know. So this is why we share the different guidelines with you, because captive agents should inform you that they only represent a single company and cannot provide information about plans from other carriers, ensuring that you, the caller, understand that their scope is very limited as far as options. But CMS doesn't mandate that they do so. So many seniors call captive agents who work for the company who tell them at renewal to stay where they are. There are really no changes for you at this time because they can only see what their company has to offer. And you will never know if there's other better options for you out there. So what should you do? Well, you should call us exactly. Call us and say, hey, I would like more accurate information, please. I'd like to know more choices. I heard that you guys are brokers and agents, senior advocates, and financial professionals who truly care. Number 3, we don't charge you for our services, and we tirelessly shop around to find the best plan in the market for you, no matter what state you live in. Number 4, we take the time to ensure your plan fits holistically, considering your budget, your family involvement, if you travel, and any additional needs like final expense, cancer, heart and stroke, critical care, long-term care, home health, dental, vision, and hearing. You are not going to hear a Medicare agent that represents only one company suggest that you buy 2 dental policies because you're going to need one for some of those outrageous things that still need to be done and won't be covered under one. So listen, we don't guide you through the Medicare process to get you to the finish line. We're committed to providing you with lifetime value. Number 5, Our senior advocates and financial professionals are extensively trained in life, health, annuities, long term care, and financial strategies because we understand that Medicare is just one piece of your holistic journey. As our client, you'll have direct access to our senior advocates, their business extensions, and even their personal cell phones. So you will always talk to the same person, your representative, every time you call. You never have to deal with carriers, long wait times, or even rude representatives or an abrupt hang up if you don't want to. We'll handle everything for you. So choosing the right agent starts with us. Call us, interview us. We welcome your calls, your questions, and your comments. We want this enrollment period to be not just fraud proof, but a genuinely good experience for you. Your health and financial well being are way too important to us to see you leave it up to chance. Use this AEP to create a lifetime relationship with people who truly care and support your health, not just during an annual enrollment period. Make the choice that puts you first. Vivix Wealth and Insurance Solutions. Alicia?
Thank you, Monet, for that heartfelt message. I love it. Now, let's evaluate carriers. Let's remember the right agent acts as your senior advocate, not just as a salesperson. Now, let's look into choosing the right insurance carrier. When comparing insurance carriers, consider the following: reputation. Look for carriers with a strong financial stability and positive customer reviews. Plan options. Do they offer plans that meet your specific needs? Not your neighbor, not your best friend, not the person across the street. Your specific needs. Provider networks. Ensure your preferred doctors and hospitals are in network. Customer service. Responsive and helpful customer service can make a big difference. Wouldn't you agree?
I agree.
Also, consider any additional benefits they may offer, such as wellness programs or telehealth services.
Okay, so that is good information because you need to know that. And when it comes to health coverage and premiums, there can be a lot of variation. So it's important to know how to evaluate them. Number one, start by looking at the monthly premiums, which is what you guys will pay each month just to have the plan. Then you need to consider the deductibles. That's the amount you'll need to pay out of pocket before your insurance kicks in. Don't forget about co-payments and co-insurance, which is your share of the cost after you've met your deductible. And lastly, check out the out of pocket maximums, which is the most you'll have to pay during the policy period before your insurance covers 100% of the remaining costs. So, by understanding these key elements, you can better compare plans and find the one that best fits your needs and your budget.
Would you say balance is the key, Monet?
Absolutely.
Well, with Secure 65 health plans by your side, you can find the perfect stability between costs and coverage without the usual hassles. Let us help you navigate the enrollment process confidently and efficiently. Finding the right Medicare plan is all about balance. While a lower premium may seem very appealing upfront, it could lead to higher out of pocket costs when you need care. It's essential to look beyond just the monthly costs and consider the overall value and coverage the plan provides. So let's break down the enrollment process into actionable steps. Assess your needs. List all your doctors, specialists, and preferred hospitals. I know I do. Write down all prescription drugs you take. I know someone has 5 pages, including dosages. Your sweetheart. Determine how much you can afford to pay for premiums, deductibles, and other out of pocket expenses. Consider any planned surgeries or treatments that may affect your coverage needs. Navigating the multitude of Medicare options can be overwhelming. I see it, I feel it. While tools like Medicare Plan Finder are available, we'll all use it. They can be complicated and time consuming. This is where Secure 65 Health Plans comes in. Personalized assistant or trusted agents offer one-on-one guidance, tailored information to your specific needs. Hassles, avoid automated prompts, long waits, hang-ups, and technical difficulties. We're your centralized resource for enrollment, simplifying the entire process. Wide availability, operating in 44 states. We're promptly accessible to assist you wherever you are. Why choose Secure 65 plans? Very simple. Selecting the right Medicare plan doesn't have to be stressful or confusing. Our experienced agents are dedicated to you, to helping you understand your options fully. We handle the complexity so you don't have to navigate them alone. With us, you can trust that you're making informed decisions without the usual enrollment headaches. No more guesswork. We provide clear, concise information tailored to you. Secure 65 Health Plans is your one stop shop for Medicare enrollment, committed to making the process smooth and stress free. Visit our website. Use the QR code below on the screen to see more information about Vivix and Secure 65 Health Plans.
Next, make sure to check out your enrollment periods, you guys, so you don't miss your window to sign up. Your initial enrollment period is called IEP, and it starts 3 months before the month you turn 65, and it ends 3 months after, giving you a 7 month span to enroll. There's also the annual enrollment period, also known as AEP, from October 15th to December 7th each year, which is what we're getting ready to do right now. Now, this is where you can join a plan, switch a plan, or even drop a plan. Also, don't forget about the Medicare Advantage open enrollment period, which is also known as OEP, which runs from January 1st to March 31st each year. And if you're already enrolled in a Medicare Advantage plan, this is your chance or your opportunity, depending on how you look at it, to switch to a different Medicare Advantage plan or go back to original Medicare and join a standalone Part D. There are also special enrollment periods called SEPs, SEPS, that let you make changes outside the usual enrollment times due to specific life events. Okay. So, for example, if you move to a new area or you lose your insurance coverage or you become eligible for Medicaid, you might qualify for a SEP. These periods give you the flexibility to adjust your coverage when life adjusts unexpectedly. And for those of you who are eligible for both Medicare and Medicaid, often called Medi or as Alicia said earlier, dual eligibles, there's even more flexibility. You can switch your Medicare Advantage or Part D plan once per quarter during the first 9 months of the year. Now, this helps ensure your coverage always, always meets your needs. When it comes to the Medigap, also known as Medicare supplement plans, the rules are a little bit different. Okay, so let me just touch on that for a minute because generally, your best time to buy or change a Medigap policy is during your Medigap open enrollment period, which starts the month you're both 65 or older and you must be enrolled in Part B, and that lasts for about 6 months. So during this time, you can buy any Medigap policy sold in your state without medical underwriting. But here's some even better news. You ready? Certain states have what we call the birthday rule. And in states like California, where I am, Oregon, and Idaho, you can switch to another Medigap plan of equal or lesser benefits without medical underwriting around your birthday each year. I think that's the best birthday gift you can get, right? This means you have an annual opportunity to adjust your coverage without worrying about health screenings or pre-existing conditions. And lastly, there's another rule commonly known as the continuous open enrollment or guaranteed issue rights for Medigap insurance policies. In certain states like Maine or where Alicia is, Massachusetts, Washington, Vermont, New York City, and Connecticut. They have unique regulations that allow Medicare beneficiaries to enroll in or change their Medigap plans at any time without facing what? Any medical underwriting. I don't know. If I didn't have a state to do it, I might have to move. I don't know. Sounds too good to be true, right, Alicia?
That's right.
So the flexibility is great. You can do it at any time if you're in any of those states. But by keeping these enrollment periods and unique state specific rules in mind, including your OEP, your SEP, your Medi options, and state specific provisions, well, you can make sure your Medicare coverage stays aligned with your healthcare needs. It's all about having the flexibility to make changes and know what the changes are you can make when you need it so you can enjoy peace of mind knowing all is well covered. And so are you.
I love that. Hey, is it my birthday today? No, it
Right?
isn't, but it's somebody else's.
Right? I love it.
So let's talk about pitfalls. So be cautious and try to avoid these common mistakes. Missing enrollment deadlines can result in penalties or delayed coverage. We don't want that. Not reviewing annual changes. Oh, we don't want that either. Plans can change yearly. Always reviewing your coverage during annual enrollment period. In these days, some of you are getting what is called ANOC, annual notice of change. So don't throw it away. Overlooking prescription drug coverage. Oh boy. If you don't take medications now, enrolling in Part D can prevent future penalties. Give us a call. We'll go through it. Also, don't underestimate the importance of additional coverage like dental, vision, and hearing if they are important to you.
And I just want to say, I really do hope from the bottom of my heart, I really, really hope that you guys understand what the Medicare process looks like. I know we went through a lot of information, and I hope this webinar has made the Medicare enrollment process clear and a little less intimidating, right? Because remember, you could always come back to this video and watch it as many times as you like. Of course, I'd like you to share it with a friend, and then I'd also like for you to give us a call because that's what we're here for. In conclusion, finding the right Medicare coverage is all about balance and understanding your unique needs and where to get it. It's important to assess your healthcare provider's medications, budget, and any upcoming medical procedures. Researching and comparing plans, whether it's original Medicare, Medicare Advantage, or Medigap, helps ensure you find coverage that fits both your health requirements and financial situation. Remember, using resources like Secure 65 health plans can simplify the enrollment process, offering personalized assistance without the hassle of automated prompts or long waits with the carrier. We're here for you all the time.
And remember, choosing the right plan can significantly impact your health and finances. Being aware of the different enrollment periods and a state specific route is crucial. That's what we're here for. Call us. Whether it's the initial enrollment period, whether it's the annual enrollment period, or whether it's the open enrollment period, or even a better one, a special enrollment periods, knowing when you can make changes allows you to adjust your coverage as your needs evolve. So now let's hear from our partner, Collaborative Expansion Foundation, and how we help seniors every day.
This is where we still have a little technical difficulties, but we smile. Okay, you guys. If it doesn't play, we're just going to tell you a little bit about it. All right. Collaborative Expansion Foundation, Secure 65 Health Plans, and Bivix Wealth and Insurance Solution provide you with all the support you need, not just for AEP, but for LTV. What is that, you ask? Well, for lifetime value. And we are here to serve, and that is our mission. So now we're going to take a chance. This may not show either. We have another video. I hope it's going to show. But it has some endearing sentiments from us and a few of our senior advocates for residents in Florida and North Carolina experiencing challenges from hurricanes. Net, let me know if that one's going to play. Well, I'm going to take this time to say happy birthday, Joe. we, al- we also give shout outs. Shout out to our members, to our friends, to our supporters, because what we do is so important because people like to be treated special. You know, sometimes you can't afford to be at some of the high end places, but you want to be treated like a high end client. Well, here at Secure 65, we are the ones that are going to make sure you are special. So I want you to understand that our personalized assistance is extended to all, whether you need help with Medicare or if you're being going through some tribulations with any of the hurricanes. Feel free to reach out to us at Bivix Wealth and Insurance Solutions because we want to be the ones that help you with whatever you need. Alicia?
Thank you, Monet. Feel free to reach out to us. You want somebody to hear what you're going through? We're here for you. You need us to guide you with a claim? We're here for you. No matter what the situation is, Secure 65 Health Plans, in collaboration with Collaborative Expansion Foundation, are here for you. So just give us a call. We'll help you in any way we can. 833-300-4968. If you have the availability to reach out to us via email, is info@mybivix.com, is info at mybivx.com. And our website, www.mybivx.com. Follow us on social media, Facebook, YouTube, LinkedIn, Spotify, Patreon, and Instagram. Thank you.
And in closing, I want to take this time to share a quote with you that I think is so apropos for us today. We try to come back in without any more technical difficulties, you guys, but maybe the information is something that you needed to have said twice. So here we go. Do something today that your future self will thank you for. Our actions and decisions today will shape the way we will be living in the future. Alicia?
I want to thank you for all joining us today. Irrelevant to the technical issues. Hey, that's what live events are for, right?
Yeah, that's what
we
life's
here with passion, with love, and to bring you health and peace of mind. See you same day, same time next week.
Yes, and thank you everyone for taking out the time to be with us today. We will see you on the same trusted senior channel on YouTube. And remember, true peace of mind comes from trusting that your health and financial needs are covered. With Secure 65 Health Plans and Bivix Wealth and Insurance Solutions by your side, you're free to enjoy every day, knowing that we've got your back. So stay happy, stay safe, and of all, stay golden. I'm Monet Swan.
And I'm Alicia Alcano. Bye for now.
Bye.
As you embark on this new chapter of your life, your health and peace of mind are more important than ever. Choosing the right Medicare plan isn't just about coverage. It's about securing the care you deserve and ensuring the comfort of your golden years. We understand that navigating Medicare can feel overwhelming, but you're not alone. Take the time to explore your options. Ask the right questions and seek the support you need. Your well-being is worth every effort. And making an informed choice today can lead to a healthier, happier tomorrow. Your journey to the right Medicare plan starts now. Take that first step with confidence and peace of mind. Vivix Wealth and Insurance Solutions, together with Secure 65 Health Plans, where seniors thrive. We are your senior advocates, Alicia Alcano and Monet Swan. Come be a part of our community, Secure 65 Health Plans. Join us October 15th through December 7th. That's our Medicare open enrollment period. Call us and drop off your ANOP or send it to us. We are the vision. We are disruptors. We are changing the way seniors do business. Become one of us. We are your community. We are here for you. No senior should ever enroll in Medicare with a stranger. Call us today at 213-394-8885 or 833-300-4968. Or email us at info@mybivix.com. Secure 65 Health Plans, where seniors thrive.